and cod liver oil. Cod liver oil supports the brain with those very important fatty acids, and I think that's what you get from cod liver oil, and the fat soluble nutrients. And now that you all know about that, we can adjourn for the evening. Let me find out, where did my participants go? Very good.
Dr. Lewis.
Yes.
This is Paula. That's rat fish, R-A-T fish. It's
oh my good. It looked like R-A-T-D-I-S-H, so I thought it was just radish, but
so I recently come across it, and it looks to be maybe even more potent than cod liver oil.
Interesting. So it's a fish-based. Okay, rat fish. Okay.
It is fish, and the company that I've seen it offered by is Rosita, and they're in.
Oh yes, they have that's the cod liver oil, by the way, that the Weston A. Price Foundation recommends, is the Rosita.
It's a pretty amazing process. It's all cold distraction and no chemicals and no heat, and it's within minutes of catching the fish. So it's pretty darn pricey, though. It's pretty.
Yep. Well, I like to. Sometimes you need that. Sometimes you don't. But what I'm going to present, and we'll start now talking about cod liver oil. But what Dr. Carter and I are going to present right now is just some history and evidence about the efficacy of a kind of normal, readily available, low-cost cod liver oil, because that's what was used mainly by my mentor at Harvard for 40 years. As long as Carlson's exist, and before that, he was probably prescribing another cod liver oil. So, cod liver oil, it's an interesting topic, right? It's like yuck, right? I mean, the people that remember taking cod liver oil when their mother or grandmother forced them to take it, that's their first experience. Yuck, cod liver oil. I mean, tonight, Jasmine, my wife, wanted to take some cod liver oil, and for some reason I messed up on an order for the Carlsons, and we have the green pastures fermented, and she really didn't want to take it, and we washed it down with some grapefruit, but that was a yuck experience for her. And I remember Diane Sawyer being on Dr. Oz, and she basically set cod liver oil back. I should have this video, but she set cod liver oil back by 20 years, because there she is, Diane Sawyer, on Dr. Oz, taking cod liver oil, turning her nose up to it, and putting a yuck face on it while she takes her cod liver oil. But, Josh Axe voted Dr. Oz the #1 functional doctor on the planet. Not so sure about that, but he certainly is #1 most popular in so many ways. But at least he took on the subject of the benefits of cod liver oil. Okay. And, but despite Dr. Oz's popularity, I'll have to tell you that cod liver oil's history goes back far before Dr. Oz entered the scene. But anyway, the summary is cod liver oil has been known for centuries to help relieve pain, prevent rickets. Bishop Borders, a church I used to go to when I was in Massachusetts, was born with rickets, and his grandmother and his mother basically treated him with cod liver oil. Rheumatoid arthritis, migraines, heart disease, tuberculosis is a biggie. This one here tells us a lot about cod liver oil, and we'll get into that. Alzheimer's and eye diseases, and I'll explain why cod liver oil has such a beneficial effect on the eye. Here's my mentor, and the reason why I have a picture of him here is because in many ways, from a evidence-based physician, he was the best of the modern era, because in 1980, he gave up a traditional ophthalmological practice at Harvard, both research and clinical, and looked upon the eye as a biomarker for systemic diseases, because he saw that association in his practice every day. And he was not an in-the-box thinker. He went outside the box. But very early on in his career, he was prescribing cod liver oil to people because he understood the physiological makeup of the retina, the omega fatty acids being a constituent, and basically provides elasticity and flexibility to very active tissue that's moving and adjusting and flexing all the time. So that's why the fish oils are very important to eye health. But what Dr. Tremp did more importantly than that is look at the evidence. So this is a scan from a modern instrument called an OCT, optical coherence tomography with angiography. So this is a really expensive OCT. But the important thing about this device is it can see down to the micron level. And most of the vessels, as Dr. Harshfeld and Dr. Smith will tell you, is that 98.9% of all the vessels in terms of length in your body are capillary single file vessels, single file for red blood cells. So this instrument can see down to that level. And, Dr. Tremp didn't have the luxury of this instrument early on, but he could see, if he saw a patient every 3 months for an ophthalmological exam, he could see cause and effect in vascular tissue like this seen in the retina. And he convinced himself early on that cod liver oil has anti-angiogenic genesis properties. In other words, you don't have as many new vessels forming because the old ones aren't getting as worn down and beaten up. And it has neurological strengthening capability. And so this is from another scan from an OCT looking at the retinal nerve layer, fiber layer in the back of the eye. And he could see sustained health of this nerve with people on cod liver oil. And in certain instances, in many instances, in fact, he could see a thickening and improvement in the health of this nervous tissue. So he was very convinced for a long time in his career, at least 30 years, that cod liver oil was helping both the vasculature and the neurological aspects of eye health, which translated into whole body health. So that's a little of the evidence that I think is very compelling. And cod liver oil helps boost immunity and protects our most vulnerable. We have for the flu, not so much with COVID, but we have high mortality rates for young children, 0 to 6, high 0 to 6 mortality. And then we start seeing mortality as we age. And what cod liver oil will do is really reduce this mortality curve. There's plenty of evidence that it has all-cause mortality reduction capabilities because of the multifactorial nature of cod liver oil. It's not just EPA, it's not just DHA, it's vitamin A in its natural form, the retinoic acid esters, not just beta carotene. It has vitamin D in its natural form, D2, D3, D4, D5, different isomers of vitamin D that you synthesize on your skin when you're exposed to sunlight. When you take a vitamin D3 supplement, you're not getting these other isomers. I haven't found any good research that says, the benefits of D3 versus the mixture, but I can assert to you that if your skin is making the mixture is more profoundly beneficial to your health than the individual. And we see that in beta carotene, where the classic study is with beta carotene supplementation, and smokers get more lung cancer, okay, than without the beta carotene supplement, because beta carotene is not vitamin A, it's just a constituent of it. So it's the whole. That's why food is more important than individual isolated substances in so many cases. So this is the important one that starts us off. I call it, food is medicine. How about superfood is medicine? And a medicinal is born, and this goes back to the Viking era, where Norwegian fishermen rubbed cod liver oil on their joints and muscles to ease soreness. By the 1700s, infirmaries were using the oil for patients suffering with rheumatoid arthritis. And so here's a quote from 1871, the British Medical Journal. today one of the most prestigious medical journals still ongoing. A woman who labored under the most excruciating rheumatism and was an outpatient of the infirmary being advised to rub her joints with the oil, was induced to take it at the same time internally. A few weeks restored the use of her limbs, and she was cured. Now, will everybody be cured by, some high dose we don't know the dose, but I can tell you, I'll show you some dosing information. Not necessarily. That's an N of one, one person, not something we hang our hat on statistically. But there are cases, Dr. Tremp had treated very frail, sick people. When they came in with eye diseases, they were sick eye in a sick body. And he had a very aggressive pharmacological treatment for a lot of people, depending on their state. But we used to say Dr. Tremp had the Tremp protocol and the Tremp Light. And the Tremp Light was nutrition and high-dose cod liver oil. And many people saw these kinds of benefits with their eyes, with other disease states. So rheumatoid arthritis, pain, it's a big one. Cod liver oil is a non-steroidal anti-inflammatory, but it doesn't hurt your kidneys. It doesn't impact the benefit you get from exercise that a lot of non-steroidal anti-inflammatories do. Anytime you suppress your immunity, you do something aggressive like exercise, you don't recover as well. And so you don't get the benefit of it. Well published. So more on rheumatoid arthritis. Several positive outcome clinical trials in RA present good evidence for the beneficial role of omega-3 fatty acid intake. So these, when you talk about clinical trials, a lot of natural substances don't have randomized clinical trials. They're too expensive. And since there's no patenting of natural substances, they're often not done. But, there are clinical trials, prospective trials, things of that nature that are more controlled, proving the effect of it. Cholesterol in my world is an anti-infective. It's a macrolide, and cod liver oil is also an anti-infective with the vitamin D and vitamin A. So cod liver oil lowers serum cholesterol. What will happen is if you've been on a low fat scenario, when you take cod liver oil at first, your LDL may go up because it's just a transport vehicle for fats. But as you quell inflammation, your body has less need for fats in the circulation, and your LDL will go down. If that doesn't make sense to someone, go look on our blogs. We did 4 very long videos on statins and cholesterol. So that's just sort of the very much the cliff notes. So high amounts of omega-3 fatty acids in cod liver oil also protect against cardiovascular disease. Thus, regular intake of cod liver oil is recommended for several purposes. Since the 1920s, health authorities in several countries have recommended a daily spoonful, 5 milliliters of cod liver oil. What does 5 milliliters translate in terms of capsules? So it's at least 5. Okay, that's the key thing. 5 capsules.
With about all the different types of human nature that are to be found.
So we are
biography or history.
I'm just doing a little muting right now. No problem. I'm sure it was more interesting than what I'm saying. But anyway, it's interesting that vitamin C, 1 gram, a lot of things, 1 gram pill. And once again, there's no money to do superior randomized clinical trials on these natural substances. So, the Framingham study does a study on fish oil and cardiovascular disease and said, no benefit, 1 gram. They're not doing a sophisticated ladder study up to 20 grams and doing all that. Too expensive, too many variables, too much money. So they do a test on 1 gram and say it doesn't work. But, everything has a beneficial regime, and in some cases, in most cases, you also have a toxic regime. So cod liver oil and the fish oils really start showing a profound benefit at around 5 grams. Kind of like vitamin C. Yes, it's good to take a little vitamin C for collagen, for healing, for repair and recovery. But if you want to fight virals, 1 gram is not the right dose. Same thing with cod liver oil. And if I'm misspeaking in any way about dosing, Dr. Carter will correct me anytime you want, Michael. But cod liver oil consumption lowers the risk of coronary heart disease mortality. So that's what I said at the beginning with that influenza or immune system curve. It's going to reduce mortality. So you look up cod liver oil and cardiovascular mortality, and there are almost 17,000 associations. So it's not a weak thing. This is a very important thing from dosing. Okay, what is the right dose? And the dose makes the poison, the dose makes the cure. But tuberculosis, British Medical Journal, 1848. 100 years before antibiotics were even barely available. 1950, 1948 was around that time frame. But they use high dose, 15 to 50 grams per day of cod liver oil in hospital patients with consumption, which is tuberculosis so bad you're literally coughing up blood. High mortality for that. So basically, they achieve stabilization and reduction of death greater in the cod liver oil group. Mortality reduced by 200%. That's a relative number, okay? But when they say statins reduce cardiovascular mortality by 28% in people with very high risk, that's also a relative statistic. Both are relatively meaningless. But when you have a number like 200% relativistically, the absolute value is really important. In fact, mortality went survivorship went from, I think it was 18%. It was about a 6% absolute reduction, a very important, significant reduction in mortality, especially considering how few survived that disease. So treating tuberculosis. So what this tells you is the constituents. We always like to isolate that single ingredient that's the anti-infective, but it's really the complex constituent mixture of cod liver oil that contributes to its anti-infective, antibiotic activity. Is it the vitamin D? Is it the D2, D3, D4, D5? Is it the cis or trans retinoic acid esters of vitamin A? Is it the EPA? Is it the DHA? That's why I said at the beginning, superfood as medicine. Don't worry about which one it is. Take your cod liver oil, right? But anyway, I won't go into this. But 1833, Henkel, big chemical company, the German family of that big chemical company, cod liver oil to treat tuberculosis was so cod liver oil rich in vitamin D was first advocated for the treatment of tuberculosis in 1770. Wonder how many people with TB are being prescribed cod liver oil today, because tuberculosis isn't gone. It's still around society. So this is what we see. 18% of disease arrested, 63% improved, 19% unchanged. And then even though this number looks the same, there was a 19% fall in deaths due to use of cod liver oil for tuberculosis. So that's an absolute statistic. That's a very important number. Those numbers aren't related, just coincident that they showed up as 19 both times. You look at something like type 1 diabetes, and the doctors say, it's genetic. But if it's genetic, why are the average age of onset of type 1 diabetes 14? I have two people right now, one 43, just developing type 1 diabetes, another one 80, just developing type 1 diabetes. I believe it's very, very much an infectious and a viral disease, can be congenital, can be picked up young during those very vulnerable years. But the use of cod liver oil during pregnancy is associated with lower risk of type 1 diabetes. Why? It's an anti-infective. So this is this kind of thing in the American Diabetes Association. I bring that to the fore. But when you go to find that, this is not a front page thing. You would think it would be. But the sad thing about cod liver oil during pregnancy, now the standard of care, they have an agenda. Pretty much their plan is, if you're a pregnant woman, we're going to do a C-section on you. So the de facto assumption is that there's going to be a major surgical event at the end of your pregnancy. And major surgical events involve bleeding. And there's an assumption and presumption, which has been pretty much indicated, that it's not necessarily a true assumption or a real assumption, that there's excess bleeding when you have a bunch of fish oil in your circulation. As long as you have good coagulation, I mean, you eat vegetables, you have vitamin K1, you'll coagulate. So it's like it's never one thing. You take fish oil and you're going to bleed out. Never. Arnold Palmer bled out on Xarelto, the product he advertised, because there's no antagonist to it. But fish oil have an antagonist. It's called vegetables. So eating fish and vegetables, not a bad deal. But the sad thing is, cod liver oil is extraordinarily important to brain development, particularly fetal brain development. And now the OBGYNs and the PCPs are telling pregnant women to stay away from fish oils. Why? Because they're planning on doing surgery on that woman. They're not planning on having a natural birth. And I think it's really kind of a criminal thing, because we're literally affecting a good and solid brain development. And we don't know where we skip to. So let's go back. Diabetes. It's an anti-cancer agent. Why? It's anti-infective. If you listened to us last week about the neutrophil to lymphocyte ratio and cancer, it's one of the strongest markers for cancer prognosis and risk. Neutrophils go up with bacterial infection, lymphocytes go down with viral infections, normally, not always. So you take your cod liver oil, and I guarantee you, if you do nothing else, your neutrophil lymphocyte ratio will come down a little bit. If you do some supporting things, exercise, diet, some things will support it, I guarantee you'll come down a lot. Take care of your oral health, things like that. So a very important thing. And I have people that are on different programs and they're discouraged from taking some of these things, or on low-fat diets. But fats are anti-inflammatory. And anti-inflammatory really means probably anti-infective, because inflammation is really a treasure, and it's peaked because something else is going on underneath the scene. So let's look here. The retin and omega-3s. So, your eye is doing this all the time. It's flexing. And the fatty acids are flexible polymers. They bend. And we all have an enzyme called elongase that takes the marine oils, or whatever oils we take in, and then promote them to EPA and DHA, which we must have for good brain and retinal health, and extends them from 20 or 22 carbon chain, 18, 20 or 22 carbon chain fatty acids up to 28, 32, 36. So the longer the chain is, the more flexible it is. Think about a short little branch and think about a long, fresh branch. Very flexible. Very important for vision. Very important to reduce inflammation. Your eye has what's called ocular immune privilege. So we have to support the immunity of the eye, because it doesn't express an inflammatory cascade like other tissue does. So that's why it's kind of a canary for the brain and other aspects of your health. We'll go into that another time when I talk more about the eye in general. So cod liver oil, potential protective supplement for human glaucoma. Dr. Tremp showed very clearly glaucoma is not a disease of pressure. It's a disease of inflammation and infection, subacute infection, with the pressure secondary or tertiary to that. So vitamin A is a crucial factor for maintaining the integrity of ocular surfaces. And I should have a slide of Dr. Alfred Summers here, but he has started a program a decade or more ago to give 2 cents of vitamin A, retinoic acid, retinoic acid, to underprivileged children in the third world, and he saved tens of thousands of children from going blind. 2 cents worth of vitamin A. That's how profoundly effective vitamin A is at protecting vision. It's a very important thing. So that's Alfred Summers at Johns Hopkins. So more things on adult eye benefits from omega-3, omega-3 fatty acids in infant vision development. And the eye is an outcropping of the brain, so if omega-3 fatty acids are important for infant vision development, you can be sure it's also important for infant brain development as well. Let's see. So really, macular degeneration in my world, in Dr. Carter's world, is a vascular disease. It's dry AMD is a plaque. Wet AMD, age-related macular degeneration, is a vulnerable plaque or worse. And when it's in your eye, it's obvious. When it's not in your eye, it can be something fatal, suddenly fatal. But something fishy about macular degeneration and fish oils, and what the author says here is the study is so convincing that he references in this article that eye physicians would be now derelict if they didn't recommend that any long-living senior consume more fish, or better yet, take concentrated fish oil capsules. And since it's 2013, I'm not sure I can reach out to this author anymore and say, dude, cod liver oil. If you're going to go to fish oil is a B+. Let's go all the way to the A. Let's go to cod liver oil. Anyway, just more studies on fish oils and maybe even cod liver oil once in a while. Fish oil studied a lot more than cod liver oil, and the health of the eyes are very important. So childhood cognitive aging, childhood intelligence, and the use of food supplements, possible involvement of omega-3 fatty acids. So there's very strong association between the aging brain, maintaining cognition, and omega-3 fatty acid intake. And there are some inferences about improving IQ in children and infants and moms taking a lot of fish oil. And I have another N of one, just one person, happened to be Dr. Trump's grandson, was taking cod liver oil, and this is right from his mom, who I know, when he was 8 months old. And last year, he got a full scholarship, academic athletic scholarship to MIT. So, Dr. Trump always used to say, if you want bright, sociable children, it's not about aging, just about aging people. Your brain is developing and is optimal. That's a piece of data I'll give when we do the talk on the eye and systemic disease. But the brain is really optimal and functioning most robustly and efficiently around 13, 14 years old. So that whole period before then, if you want to have a super optimal brain, that's when you need to get your cod liver oil into our children. So effective supplementing pregnant and lactating mothers with omega-3 fatty acids on children's IQ and body mass index. The study suggests that maternal concentrations of very long-chain polyunsaturated fatty acid during pregnancy might be an important for later cognitive function, such as sequential processing, whatever that is. But, it's an attribute of brain function, so it's good. But, looking at quality, people worry about quality. I know Dr. Mercola worries about quality, and he's right. Today, a lot of them, even the Carlsons that I recommend, are quasi-processed foods. But here's a little bit about what they do. First of all, Chris Kresser, the spelling, he's a good medical scientist, in my opinion, about the toxicity. I'm not going to go into this in great detail, but he basically says that the processing of distillation removes a vast amount of toxins, and then they repopulate the cod liver oil with the fat-soluble nutrients to make it what it was supposed to be in nature, if nature was pure. So anyway, that's from Dr. Kresser. And then, there is a refining process. You're not going to hide that in the covers. They refine the crude, they dry it, winterize, deodorize, and then standardize put vitamin contact back into it. So here's a little information. Use that word a lot. Information on how cod liver oil is produced and processed. So, and then, there's this is an industry representative or lobby, but you know, what I do to protect myself from toxicity from ocean foods is number one, go back to as close to the beginning of the food chain, so toxins aren't as concentrated or aren't concentrating up the food chain. So sardines, but also I rotate my cod liver oil. So right now we're doing green pastures. I just ordered some Carlsons, and then in the queue I'll be ordering some Nordic Naturals. So we'll just go through a bottle, and then just keep rotating, just rotating through. And you know, who was it? Pat, did you mention? I forgot the brand already. I haven't had. No, I just had my cod liver oil. But anyway, the group the brand that Weston A. Price recommends, which is slipping my mind right now. But this is just more or less a summary. Cod liver oil high in vitamin A's and A and D, and of course we'll publish this. Calories. Craziest thing ever. I was at this corporation running our program, and a parallel program was on weight loss. You know, Dr. Carter was the overseeing doctor to that program, and people who were in our program and the weight loss program, some of them were so strict in calorie counting, they said they would not take cod liver oil because it had too many calories. You can't make it up. So yeah, 40 calories in 5 mils, you know, heaven forbid. And here's a little bit on the statistics of the constituents of cod liver oil. Let's see. May reduce inflammation. So this is a very conservative article, but sort of review. Yes, I think the word may, if you're only taking 1 gram, if you're taking 5 to 15 or 30 grams, I think the word is definitely improve bone health. Vitamin D helps shuttle calcium out of soft tissue. Very important. May reduce joint pain, improve rheumatoid arthritis. Anti-inflammatory, also anti-infective. Periodontal disease can get into joints and cause a lot of pain. Cod liver oil will help reduce that burden. We talked about eye quite a bit. Heart disease was referenced, but this is good because it has, you know, more references. I don't give all the references in the talk, but I do have a link to this article in our talk, so it has all these references. May improve symptoms of anxiety and depression. I really mentioned that earlier, but we have testimonials of people that have got off their SSRIs and they go on a cod liver oil regimen. And we never recommend going off an SSRI cold turkey ever. It might take you 6 months. But we'd never even start that process unless you've been on high dose cod liver oil for at least 3 months and start kind of remodeling the wiring, if you will, because omega-3s are involved in the wiring of your brain. And when you remodel that, then you may be in a position to start getting off some of these nasty medications that turn you into something sub-you that you don't want to have. May help heal stomach and gut ulcers. I've had many reports from folks that have come on our program over the last several months that say they've seen gut symptoms improve. I often am reticent to recommend cod liver oil if you're having severe reflux, because you may reflux, you know, fermented fish oil, cod liver oil, and you may not really appreciate that. But I've had some people tell me that they really feel the cod liver oil has helped eradicate their reflux. So makes total sense. Easy to add to your diet. And what I recommend is you take it on a full stomach after dinner. Why? I personally have had some cod liver oil burping. It was a long time ago, though, 30 years ago, 25 years ago, when I took it on an empty stomach. I don't think you get if you just take, you know, 5 or 10 or 15 grams of just oil, you know, let it be butter or olive oil or coconut oil on an empty stomach, I think it might cause a little stomach distress. Doesn't really actuate all the digestive juices. So I think it's better to take it after dinner, and you sleep for repair and recovery anyway for your brain and your eyes. So that's a perfect time to take it. And let's see, I've got to hunt around to see. So here's Weston A. Price, Eat Fat, Lose Fat, Dr. Mary Enig and Sally Fallon. They call it the #1 superfood. and I just pulled a clip because I had their book on my shelf. The most important superfood is cod liver oil, which we recommend for all our diet plans, so on and so forth. And they explain about the importance of nutrient density, and it's an extremely nutrient dense food. And there we have it. Line up and take your cod liver oil. Anyway, let's stop share. And Dr. Carter, you still in the house? Did I mute you, Dr. Carter? Unbelievable. Hold on one second. Let me see what we did here. Oh, I did. Unbelievable. Sorry, Michael.
That's okay. You can hear me?
Yeah, what happens is when people are coming in and leaving and I go to hit mute, the list moves and sometimes I miss.
Oh, gotcha.
I missed out on that. But we have 17 new messages. Let's see what we have here. Questions. Okay. So video. I've recently heard about the rat dish. Okay, Paula, yeah, thank you. The rat fish. Okay, we'll look it up. What is the optimal level for serum ferritin? Mercola says less than 100. So, what do you think the lower limit is for ferritin, Michael?
The lowest limit, or
the lowest optimal limit?
Oh, that's probably in the 70 to 80 range. Yeah, then when it starts getting lower than that, then you're getting starting to deplete your iron stores.
Yep. Is there a good liver supplement if you don't like to eat it? Oh, because I was talking about liver. Do you know of a liver supplement, Michael? I'm sure.
Yeah, they have several desiccated, liver supplements or organic ones. I mean, I can't recall the name, but I would imagine there at least one or two on our Fullscript site. So just looking for desiccated liver.
See, but you don't understand is I loathe beef liver. But what you do to make pate, lots of butter, lots of sauteed vegetables, some sauteed liver, garlic, sage is a really good seasoning for it. You just saute it lightly. I put mushrooms, peppers, carrots. I kind of parboil the carrots first and then saute them in there. Onions, obviously. And then you just blend it in a food processor. And I have a little coconut milk to add to it in case I need it to be a little thinner, and salt and pepper and some other spices. And I will tell you, if I can have pate at 7 in the morning on a Saturday before a long bike ride, you can like it too, because I really dislike liver. Okay, just saying. OCT spells out to what? Optical coherence tomography, measuring, creating three-dimensional images. Should you take cod liver oil with or without food? I answered that at the end, Nancy. I would highly recommend taking it with. My understanding is that the surgical plan for deliveries is primarily for staffing, because staff can be scheduled for surgeries to do. Yeah, I know that's true, but that's what they tell you. But it's staffing, it's convenience, it's quickness, it's getting in and out. But I can tell you what, it's not in the best interest of health. Michael, I need the MD to back me up on that.
No, I agree. I would agree. Absolutely.
What did you say was the therapeutic dose of cod liver oil? Well, Linda, it varies with your your omega-6, omega-3 ratio, but 5 mils at least. And what Dr. Tremp did, is he measured the red blood cell omega-3 complex. And what he normally would recommend people do is minimum 15 grams, half a shot glass a day for 3 months, and then you can back off a little bit. So I do about 15 grams sort of every other day. 5 grams, 1 teaspoon, as I understand it. Yes. A measuring tablespoon, not one pulled out of your utensil drawer, is the 15 grams. A measuring tablespoon. But I just use half a shot glass and shoot it. A little easier. Glaucoma is a disease of what? Michael, do you want to expound on?
Well, the small vessels. I mean, the traditional doctors, ophthalmologists, of course, will tell you it's a pressure thing, but in reality, it's still it's an inflammatory process that's going on from various causes, whether subacute infections, what have you, a whole host of things, mycotoxins, heavy metals. Yes, pressure does have something to do with it, but even in individuals who have normotensive glaucoma, which means that the intraocular pressure is 9, 10, or 11, which is well within normal ranges, there can still be deterioration. And even in those who have high pressure glaucoma, once it's still controlled, if that's the only thing that's being addressed, there will still be deterioration in vision. So it's definitely not just a pressure problem.
Thank you, Michael. Doris asks, is it too late to increase brain or IQ as seniors? Absolutely. You're done. The answer is, if you want to watch a fascinating thing on the brain is another muscle. Jasmine always says, it's all about, you're going to exercise your gut muscle. You're going to exercise your this muscle, your brain muscle. So the BBC had a fascinating multi-part series on brain featuring taxi cab drivers of the London streets before GPS. And these folks had to memorize the entire, map of the back streets of London. And they had extremely enlarged hippocampuses. So, if you can increase the size of your bicep at the age of 90, which you can increase the size of brain. What happens is, when you're working in the workaday world, a lot of challenges, a lot of stress, things like that. Stress is good. So it's like, you got to keep busy. You can't be Luke busy. I don't know if anybody knows that reference, but Car Talk at the end, the Click and Clack always had their list of their contributors, like their attorney, Dewey, Cheatham, and Howe, and then the other one was Luke Busy. Bad joke, but anyway. Michael, you get a laugh at least. How does krill oil compare to cod liver oil?
How is what now?
Krill.
Oh, well, again, the krill oil has the component of the phospholipids. So probably a little more absorbable. I know Dr. McCullough really likes the krill oil. But both very efficacious.
Yeah, and I think you're going to have more of the fat solubles, but if someone's taking, generally speaking, when I talk to someone who's taking krill oil, I never suggest they get off the krill oil. I suggest they just add some cod liver oil to it. If they're taking fish oil, I say, hey, if you're going to take fish oil, go all the way to cod liver oil. But Linda, it's green pastures, but it's the blue ice. I just looked it up. It's blue ice. I mean, I'm dyslexic with my colors, but yeah, it's green pastures, blue ice. Wow, we have a bunch more messages. Or questions. Let's see what we get here. Rosita, thank you. The Rosita, I haven't used that, but I hear it's a really good brand of cod liver oil. So you get the Rosita, Nordic Naturals, Carlson's, and then green pastures. Can CLO reduce the progression of cataracts? I'll leave the eye comments to Dr. Carter.
I I would say that it can have a role because of its anti-infectiveness. And again, cataracts being, a precursor for those folded proteins, which can come from subacute infections. So yes, yeah, it can be beneficial. Absolutely.
Frank, you said, is CLO better than any allopathic drugs? That's a topic, but I would say in 90% of our population, if you took CLO from birth to death, you'll probably be drug-free. That's my guess. Not 100%, obviously, because stuff
We
happens.
live in a very toxic environment.
We live in a very... So explain D2, D3, D4, D5. I only know about D3. Basically, vitamin D is not... Most things in nature are not a single compound. They're mixtures.
Right.
Vitamin A, cis and trans-retinoic acid, beta-carotene. Many things are mixtures. Nature, you are a symphony, not a flutophone.
Yeah.
And my criticism of many studies is we try to isolate the effect of one little thing and then make an assumption that it doesn't have efficacy because when we isolate it from everything else, it doesn't show effect. It's because it all works together. That's what makes cod liver oil a superfood. So don't ask me the structure of D2, D3, D4, D5, but it's very easy to find. And there's going to be just subtle differences. And, but in nature, subtle differences, like the way an enzyme's formed or the metal in it, can make big differences in terms of how they impact your health. Paul Saladino has beef organs for sale in capsules. My recommendation, if you are afraid of organ meat, and one of these days we're going to do a talk on organ meat, is go get some duck. And the fat is so delicious, and you can cook the organ meat in it, and it's very, very mild compared to, say, the beef organs, and very nutritious. Oh, he wrote the carnivore code. Okay. Why does it seem so difficult to get Lugol's 2% iodine? It seems to be out of stock everywhere. Dr. Carter, can you address that? Are you hoarding that with your celery?
Well, it's probably very popularized with Dr. Brownstein, with the use of the food grade hydrogen peroxide, and also then the iodine that is mixed with that in a nebulizer. As a matter of fact, I've taken care of 2 patients with coronavirus that had significant symptoms. And in addition to being on, all of the baseline, supplement regimens that I recommend, they also utilize the nebulized food grade hydrogen peroxide and iodine. It is very, very efficacious. So I would imagine that is one of the reasons why it is out of stock. I know it's in stock on FullScript on our platform. So
excellent. Best way to increase ferritin level. Who gave me that T-ball question? Lauren. Liver. I don't know what's second best, but liver is pretty much at the top. Meats, obviously.
Yeah. Anything with a good iron source. Yeah. But again, it also has to do with absorption. And if you are not making good hydrochloric acid to actually make that absorption, work. So yeah, that's really, really important.
Very good point. When taking 1 tablespoon of cod liver oil per day, will I need to add additional vitamin D supplement? My level just tested was 82.
Oh, that's pretty good level. Yeah, it's rare to find someone who has a vitamin D level of 82. So, and obviously you're, getting extra sun in addition to the cod liver oil, so you should be fine.
Yeah, but I think cod liver oil only has about 400 IU per. Maybe it's.
Yeah, again, well, Dr. McCullough, he touts that he gets plenty of sun and he doesn't take extra vitamin D supplements. So
sure.
So, but some people are, quite adept at, absorbing the sun rays and really making adequate levels of vitamin D. The vast majority of people do need to take extra vitamin D. But if your levels are 82, you're in a good shape.
Yep. The question is, how can I lower my ferritin level? It's too high. I've had good experience by using a chainsaw a couple times. No, but really giving blood is probably
that's the best way.
Yeah. So that's how I gave blood a couple times.
Yeah.
Does Crohn's disease reduce your absorption level?
Oh yeah, absolutely.
Yep. We have reached the end of the questions.